How do I debunk cervical cancer myths about HPV? To effectively debunk myths about cervical cancer and human papillomavirus, or HPV, we need to focus on clear, factual information. First, it's important to understand that HPV is extremely common. In fact, about 80% of sexually active individuals will be exposed to it at some point in their lives. However, just because someone has HPV does not mean they will develop cervical cancer. Most HPV infections clear up on their own without causing any issues. Only persistent infections with high-risk types of HPV, particularly types 16 and 18, can lead to cervical abnormalities and cancer over time. But this progression is not guaranteed. Another common myth is that only promiscuous individuals can get HPV. This is simply not true. HPV is transmitted through skin-to-skin contact during sexual activity, meaning anyone who has had sexual contact can be exposed, regardless of the number of partners. This misconception can lead to stigma and prevent open discussions about HPV and cervical cancer. It's also crucial to note that HPV affects both men and women. While we often hear about HPV in relation to cervical cancer, it can also cause other cancers in men, such as penile and anal cancers. This broadens the importance of awareness around HPV beyond just cervical cancer. Regular cervical cancer screening is essential, even if you have been vaccinated or are not currently sexually active. HPV can remain dormant for years, and cervical cancer can develop long after the initial infection. Vaccination helps protect against the most common high-risk HPV types, but it does not cover all cancer-causing types. Therefore, regular screening remains vital for early detection and treatment of any precancerous changes. Speaking of vaccination, the HPV vaccine is safe and effective in preventing cervical cancer. It protects against 9 HPV types responsible for over 90% of cervical cancers. Clinical trials and ongoing monitoring have shown its effectiveness in reducing HPV infections and related conditions. There are myths that the vaccine causes infertility or autism, but these claims are unfounded. The vaccine is not a substitute for screening. Rather, it is a preventive measure. It's also worth mentioning that cervical cancer is not contagious like a cold or flu. It results from a persistent HPV infection that is transmitted through sexual contact. Myths suggesting that cervical cancer is contagious or linked to promiscuity are false and only add to the stigma surrounding the disease. Lastly, while having multiple births or starting sexual activity at a young age may increase the risk of acquiring HPV, these factors alone do not directly cause cervical cancer. The key factor is the persistent HPV infection. To debunk these myths effectively, we should encourage open conversations about HPV and cervical cancer. Promoting vaccination for eligible adolescents and emphasizing the importance of regular cervical cancer screening can help prevent misinformation. Always remember to seek personalized medical advice from healthcare professionals for specific risks and screening needs.